Hey, my name is Kevin Olson. I'm here to do the postpartum assessment for my patient. To preface, I have a note sheet here. Nothing else open, but just notes for the bubble, mnemonic, and all that. So I'm gonna get started.
So I would sanitize my hands.
I would come in, sanitize,
And then I would
introduce myself to the patient. Hi, my name is Kevin Olson. I'm a nursing student today. Could you give me your name and your date of birth?
The first hour.
Awesome, perfect. So I'm here today to do a postpartum assessment on you. I know you just had a baby yesterday. Congratulations, by the way. And I'm just here to see how your healing is going and making sure everything is good to go. Okay. So first, I'm just check your vitals. So we'll do a thermometer or a temperature check.
I would take a listen to the belly, listen
Open mouth
for
rate.
bowel sounds, and ask them if they have passed gas after giving birth yet.
All right.
And
Perfect.
then
Thank you.
I would begin by taking a look at the breasts.
Now I'm gonna do
I would just
blood pressure.
palpate the breasts, take a look at them for symmetry, fullness, look at the nipples for any cracks, redness, discharge, any inversion that
Okay.
wasn't there prior to
Looks good. Blood pressure looks great for
and
here.
then I would
Now I'm going
go
to
down to the
check the
uterus,
pulses.
take a
This
look
on you.
at the
I'm also going to listen to your heart and lungs while this is going.
on the Chuck's pad and any bleeding on the pad that they have in their underwear, and note the amount of blood, the color, if there's any clots. And I would palpate the fundus, feeling for firmness or fogginess.
Alright,
And
lungs or
then
heart sounds good. If you just sit up for me, I want to listen to your lungs. You can breathe in for me on these spots. Okay, breathe in.
Assess the
Okay.
uterus because
Breathe in.
if you have a full bladder, it can
Breathe in.
move the uterus and
Breathe in.
cause false assessments.
Breathe
And
in.
then I would
Breathe in.
take a look
Breathe in.
at the vaginal area, looking for if
Perfect.
they had
Thank you.
episiotomy,
It looks like your pulses and oxygenation are good. There.
patches, if there's any bruising.
All right, now I'm just gonna do the assessment going off of my bubble mnemonic. This first one is gonna be your breasts. I'm just gonna check in. I'm gonna get some gloves first.
Pulses, looking for edema, redness, swelling, warmth, things of that nature. And then I would go on down to the legs,
Now the purpose of this is just to check
and I would
if I see any
specifically look for any
swelling
redness
or any lumps or any discoloration, any pain or anything.
And I would just have my
No.
patient flex their
And are you
foot back,
lactating okay?
looking for that home
Baby's
sign.
latching just fine too?
If they have pain when
Okay,
they flex the
perfect.
foot
You let
back,
us know if
that
there's
can
any
indicate
issues with lactating or
but my
any
patient
swelling
doesn't
or
have that, so that's
pain going on with
good.
that, okay?
And then I would
The
just
other side
see how they're
looks
feeling.
good
Was
too.
birth what you
Perfect, that's the
expected
B.
it to be? Was it harder? Was it easier? Just talk through.
Now you
sort
is
of
your
how
uterus.
they're
We're gonna check on how your uterus is healing.
just looking at that mood,
So
affect,
I'll hold the uterus in place and then I'll palpate downwards till I feel firmness, and I feel it right here. Any pain or any swelling or anything as I do that?
Oh, I didn't
No,
talk
perfect.
about
All right. Yeah, it looks like it's good there. Now the other B is the bladder check. So the same thing. Oh, I forgot to do a bowel sound check for my assessment, so I'm gonna do that right now too.
Yeah, I'll just.
I'll listen for a minute in each quadrant.
Now you got it in the bag. Now you know what it's all about.
All right. Active in all quadrants looks good there. So the next step would be the bladder check.
Hi, I'm Maggie.
And again, I'm just checking to see how firm it is. When was the last time you emptied your bladder?
So I would
Any pain with that?
sanitize my hands, put on
Okay,
my
good.
gloves, and I would begin
And then
by
just a reminder, they give you this peri bottle to sanitize and clean your peri area after going to the bathroom. Just keep it clean, keep it away from infection, and make sure you're doing this every time you go, okay? And the next B is gonna be bowel. So I just oscillated, but now I'm gonna palpate.
Once an hour, my
When was the last bowel movement that you had? Okay, everything was good there.
Start by taking
Solid.
a look at the breasts.
And I would palpate each
I'm
quadrant.
just gonna palpate the breast.
All right,
for
firm, non-tender, looks
symmetry,
good.
wholeness, if there's any
And then
tenderness. Take
now
a
I'll
look at the
turn you on your
nipple
side.
area as well, looking for any inclusion that was
I'm
not
gonna take a look at your underside, okay?
any crackles and ripples.
And the L in bubble is to look at your lochia, your discharge. It looks like it is bright red, and that's okay for right now. It'll throughout the days of healing, it'll go from bright red to pinkish, and then should go to clear. If you go back to bright red in the next few days, make sure to call us, let us know, and you'll have to come in and we'll get that checked out, okay? But it looks like everything's good here, good amount of drainage, or not too much drainage, and it's bright red for now. And we'll check again every 15 minutes for the first hour or two, and then we'll move to 30 minutes, and then we'll do an hour check after that. All right.
I would make sure to.
The E is episiotomy, so the incision in the perineal area between the vagina and anus. I'm checking, and it looks clean, dry, and intact. No redness, no edema, no swelling. Any pain with incision? No. Okay. Again, this is important for the peribottle to clean it every so often, so we stay away from infection. But it looks good there. All right. Now I'll put you back on your back here.
And then I would just take a look at the perineum area.
And then the next E is extremities. So I'm just going to check on your peripheral pulses, making sure there's no DVT, no clotting, no swelling. Your calves are not warm to the touch, no swelling noted here. I would do Homan sign, so I would just have the patient try to dorsiflex the foot. If there's any pain or tenderness in the calf unilaterally, then we know that's a possible sign of DVT. But nothing there, so that looks good. And then lastly, emotional. How are you doing after I would ask the patient how she was doing after the delivery, ask how the body's going, ask lactation. Everything seems fine. Look for signs of postpartum depression. And it seems like the patient's doing good. At this point, I would also tell them about a few things to be aware of. How you shouldn't have intercourse for 5 to 6 weeks, I believe it says. Yep, 5 to 6 weeks. Just allow it to heal, and we don't want any tearing to occur down there. So everything looks good. Thank you for letting me examine you today, and have a good rest of your day. Let us know if you need anything else. All right, now we're gonna move on right into the C-section video. Don't mind this. I'm just gonna pretend it's there.
Tux pads, which are
It's gonna be the catheter,
underwear.
and I'll be entering the room. I'll be doing the same exact examination as before, minus a few alterations. So with the cesarean C-section delivery, I would first check this incision site, make sure the dressing is clean, dry, and intact, and then when the surgeon allows us to, we'll remove this to look at the incision site. Make sure it's redness, there's no redness, there's no edema, hemosis, drainage looks okay, and then approximation of sutures. Everything looks clean and no swelling or signs of infection, so that looks all fine and dandy there. And then I would also check for the urinary bladder, or the drainage bag, see how she is draining urinary. You want 30 milliliters per hour, so we're checking that, getting rid of it if we need to. And then also after surgery, we want to make sure the lungs are back and optimal, so we have them do incentive spirometer. We want to have them inform them about practicing that after surgery. Deep lung or breathing exercises and all that. Maybe moving their legs in bed to stop from DVTs or clotting, and then get them ambulating as soon as possible. And then we can remove the catheter, and then we can begin to do assessments and everything for that. Thank you so much.